Hello everyone, this is me, Sneha. Infection prevention doesn't depend on one big step. It's a collection of small, consistent actions. That's what we call bundle care, a group of simple practices that, when bundled together, save lives. So, today's video is all about bundle care. Bundle care is a group of evidence based practices that are performed together to achieve better outcomes in infection prevention. Each individual step may seem small, but when done collectively and consistently, they significantly reduce the risk of hospital acquired infections. The idea behind a bundle is standardization, ensuring that every healthcare worker follows the same set of best practices every single time without missing any step. In single terms, bundle care is about turning daily care into safe care through teamwork, consistency, and accountability. Let's dive into each bundle, focusing on what we actually do in our wards and labs. The first type is VAP, Ventilator Associated Pneumonia Bundle. The ventilator associated pneumonia is a type of lung infection that occurs 48 hours or more after a patient is intubated and placed on mechanical ventilation. It's one of the most common and serious hospital acquired infections seen in ICUs. When a patient is on a ventilator, the endotracheal tube bypasses the body's natural defense mechanism. The secretions from the mouth, nose, or stomach can leak around the cuff of the tube and enter lungs. Over this time, the bacteria colonize the tube and forms biofilms. These pathogens then cause pneumonia. The common organisms that are responsible for cause are gram-negative organisms such as Pseudomonas aeruginosa, Klebsiella pneumonia, and E. coli. Gram-positive organisms such as Staphylococcus aureus, especially MRSA, and others like Proteus species and Serratia. Let's dive into the prevention techniques of VAP. Always keep the patient's head raised or elevated from 30 to 45 degree so that it can prevent aspiration. Oral care with chlorhexidine should be taken every 8 hours so that it reduces the colonization. The axis red lines to extubate so that it minimizes the ventilator days. Use special tubes if available so that it can remove the secretions above the cuffs. Hand hygiene is very important and do it always before and after contact so that it can reduce or stop the cross infection. Follow drain condensate properly. It avoid black flow contamination. The lab perspectives of VAP is vital. Collect the endotracheal aspirate or bronchoalveolar lavage and perform gram stain along with culture. Interpret the growth carefully to avoid reporting colonizers as infection. Preventing VAP isn't about one big intervention. It's about small, consistent practices that keep every breath safe. The next type is CAUTI or CAUTI, which refers to the catheter associated urinary tract infection bundle. The CAUTI is a urinary infection that occurs in a patient who has an indwelling urinary catheter in place for more than 48 hours. It's one of the most preventable hospital acquired infections if catheter care bundles are followed strictly. When a catheter is inserted, it provides a direct pathway for microorganisms to enter the bladder. Over time, the bacteria can migrate along the catheter surface or travel through the drainage system. These bacteria form biofilms on the inner and outer surface of catheter, making infection persistent and resistant to antibiotics. The common causative organisms for CAUTI are gram-negative organisms such as E. coli, Klebsiella, and Enterobacter species, gram-positive organisms such as Enterococcus species and Staphylococcus aureus. Also, fungal organisms can be seen in long-term cases such as Candida species. Let's see what are the preventive measures that can be taken for CAUTI. Hand hygiene is important before and after the insertion so that it can prevent bacterial transfer. Always do aseptic insertion and use sterile gloves and lubricants to reduce the contamination. Never disconnect unless needed so that it can avoid the backflow infection. The secure catheter should be properly inserted and avoid pulling so that it can prevent the urethral injury. Daily hygiene is vital. Clean with mild soap and water and prevent colonization. Access daily for needed and remove the catheter when not necessary so that it can reduces the infection risk. The lab perspectives for CAUTI. Collect the urine sample aseptically from the sampling pot and not from the collection bag. Perform urine culture and sensitivity. If the microorganisms have greater than 10 raised to 5 colony forming unit of a single organism, it's found to be significant bacteriuria. Always correlate with clinical signs before labeling CAUTI. A catheter may drain urine, but it can also invite infection unless we care for it the right way every single day. The third type of bundle is CLABSI or Central Associated Bloodstream Infection Bundle. CLABSI is a laboratory confirmed bloodstream infection that develops in a patient with a central venous catheter that has been in place for more than 48 hours before infection onset. It's one of the most important serious healthcare associated infection leading to prolonged hospital stays, sepsis, and higher treatment cost. A central line gives direct access to the bloodstream, which makes it life-saving and also very risky. Microorganism can enter the line through insertion site, catheter hub, and contaminated infusate. Once inside, the pathogens adhere to the catheter surface, forming biofilms that protect them from antibiotics and immune defense, leading to bloodstream infections. The common causative organisms in this case are gram-positive organisms such as Staphylococcus aureus, coagulase negative Staphylococcus aureus, gram-negative organisms such as Klebsiella pneumonia and Enterobacter species. In case of fungal, Candida species has been reported, especially in ICU patients. Let's dive into the preventive measures taken for CLABSI. Hand hygiene is important before insertion and also during the care so that it can prevent the contamination. Use sterile gloves, gown, cap, mask with full barrier precautions to prevent the microbial entry. Use skin antisepsis such as 2% chlorohexidine for cleaning the site, which has been used as broad spectrum disinfection. Selection of site is important. Always prefer subclavian vein over femoral so that it can lower the infection risk. Daily reviewing the line is important and remove the line if not needed so it can reduce or shorter the exposure time. The aseptic techniques should be always followed for dressing so it maintains sterility. The hub infection is vital. Always scrub the hub with alcohol before use so it reduces the surface microbes. The lab perspective of CLABSI. Collect paired blood culture, one from catheter lumen and one from peripheral vein. If the catheter samples become positives within 2 hours earlier than peripheral, it is suggested as CLABSI. A central line saves lives, but only when handled with sterile hands, careful eyes, and daily awareness. The fourth category of bundle care is SSI or surgical site infection bundle. The infection that occurs within 30 days after surgery or up to 1 year if implant is placed at the site of incision or operated tissue. The common types of SSI are superficial, deep, and organ. In case of superficial, it includes skin and subcutaneous tissue. Muscles comes under deep SSI and the body cavity comes under the organ SSI. The common organisms responsible for SSI includes Staphylococcus aureus, which are most commonly seen, coagulase negative Staphylococci, Enterococcus, and E. coli. The risk factors include poor hand hygiene, prolonged surgery duration, and contaminated wound. Let's see what are the preventive measures taken for SSI. Pre-op bath with antiseptic is vital to reduce the skin flora. Always remove the hair if needed, otherwise don't do, to avoid microcut and infection. The proper surgical hand scrub should be maintained to asepsis. The sterile instruments should be used to prevent the contamination. The timely antibiotics prophylaxis to be done within 1 hour before incision so that it ensure drug presence during surgery. Maintain the glucose control level so that it promote healing and reduces the infection. Regular wound assessment and documentation should be carried out to detect the early infection signs. It's not just about protocol, but about consistent commitment to care at every moment. When every hand follows The bundle clearly every patient heals better. That's all for today. Thank you for your valuable time. Stay tuned on Medical Guruji for next interesting microbiology facts. Still that, thank you and bye bye.